Hello, my name is Martin Gray. I'm a paediatric intensivist by trade and I work at Chelsea and Westminster Hospital in London. I've held a couple of CXIO roles in the past and I was Divisional Clinical Information Officer when this project presented itself to me. We all know that health data sharing is regarded as a key solution to address the demands and costs faced by healthcare systems going forward. It's therefore crucial. Locally, I was presented with two challenges in relation to health data sharing. Firstly, we had a group of people living with HIV who'd previously opted out for sending letters to their general practitioners, and it was imperative to find a solution as we prepared to connect to the London Care Record. And secondly, we'd failed to uphold some of the opt-out requests, resulting in complaints, issues and litigation. Consequently, it became necessary to encourage more individuals to opt in to health data sharing. Unfortunately, prevailing scepticism exists towards this practice, exacerbated by the NHS's reputation. This lack of trust is further fueled by the fact that in 2021, the 2 years previously, there had been 3,557 breaches recorded to the Information Commissioner's Office from the NHS. Also, I found that at the start of this project, the IT professionals had quite an interesting approach to data sharing, over-relying on the Data Protection Act legal clauses, and I found that the attitude was that we were going to share the data anyway. When I looked at the legal frameworks and guidance, I thought they were woolly at best. Ultimately, the guidance leads to the local trust having to conduct a data protection impact assessment, which goes full circle and essentially brings it back to the trust to implement. Given these obstacles, there needed to be some kind of solution to increase data sharing in the population I was studying. As part of my studies on the NHS Digital Academy MSc course, I chose to focus on this project, data sharing in marginalised populations, and I used the patients or people living with HIV to represent them. The objective was to understand how we could reduce opt-outs to realise the benefits of data sharing. After conducting a literature review, I discovered that this is an understudied area. However, existing research confirms that although data sharing is generally approved of, there's a growing scepticism, and particularly amongst marginalised groups. To address this, I applied standard qualitative methodology, conducting a document review using text published by the Information Commissioner's Office, the National Data Guardian and HM Government. I also reviewed hospital data incident reports and complaints, although I wasn't given any access to active litigation. To gather primary data to support this, I approached people living with HIV, their advocates and their caregivers. I submitted a questionnaire to them, and after obtaining their consent, I received 52 responses. I also conducted 9 structured interviews from those respondents. The data was analysed, and through an iterative review process, the themes presented on the right-hand side of the slide were defined. The key findings of this research were that most respondents acknowledge the importance of data sharing and see the benefits. In most incidents that I analysed, human error was a significant factor. This included staff using workarounds, not following prescribed workflows, and flagging and alerting failures. Some incidents also involved certain technology issues such as data leaks, particularly from outsourced services such as laboratory, and issues with how the spine updates demographic data. It was shown that our staff needed to be better trained in information technology, information governance and policy, a root cause of some of the human issues that we'd found. The healthcare information infrastructure is complicated and getting more so, and people are just simply unaware of what happens to data at the end of a transaction when they press sign or send. A significant finding was that a lot of technology was either not used at all or not used properly. Looking at the survey data specifically, staff members want more IT and IG training to be able to deal with their patients better, and patients just want to be more involved in their care. Looking at the recommendations that this data led to, we should prioritise the development of regional and national policies for health data sharing. It's essential for any trust to align its information governance policies and processes with the current, recently published guidance. All existing healthcare information systems should be fully deployed and utilised to their maximum potential. This includes implementing user access control properly, using flags and alerts, and generating reports to monitor and ensure data privacy and security. Going forward, we should also consider electronic consent processes. We should embed compliance with national and best practice guidance into the procurement process, so these functions are embedded in any healthcare information systems that are procured in the future. By addressing these key points, we can work towards establishing a robust and trusted health data sharing system. The key messages are to ensure universal health data sharing for direct care. We need to train staff to engage with patients and discuss the risks and benefits of data sharing. Effective communication with patients is crucial. Better training is needed for staff on patient confidentiality, information governance, and data sharing. Staff and patients need to learn about the value of data and their roles as healthcare data custodians. The work that I've conducted has led to further PPI work at Chelsea and Westminster Hospital, led by Victoria Betton from people.com. She's then produced a report, and Victoria's report will be fed back to One London in a few weeks' time. We hope that it will lead to regional and national guidance to be developed. Thank you for listening. You can contact me on my LinkedIn profile on the left-hand side of the screen, and the references are available from the QR code on the right-hand side of the screen.